Denver Health is a safety net hospital for the city and county of Denver, and frankly, for much of Colorado. What that means is that we are there to take care of patients at their most vulnerable, when they are in crisis, when they have healthcare needs, when they just need somebody to be able to help them live a healthy, full life. For us, our patients are mostly truly the most vulnerable people in our community, homeless individuals, people living in poverty, and we step forward not just to provide healthcare, but also to help them deal with the issues they face in their everyday life. But equally important to those is our role as an anchor institution, which really is the idea that as a large organization in our community, touching the lives of people every single day, that we impact the social and economic circumstances of their lives as well. Through the work that we've started with our Center for Equity, Diversity, and Opportunity, we really are focusing on how can we bring economic opportunity and economic mobility to the community. And what that really means is we're looking at the circumstances of a person's life, understanding that 80% of what affects a person's health status has nothing to do with the medical care they receive. If you don't have a place to live, if you're not able to eat healthy foods, you don't have an education that allows you to get the kind of job you want, thinking about maintaining your health and well-being is very difficult. The connections between a person's social and economic status and their health status is deep. And research has shown if we can address the whole continuum of issues, the health needs that people have, of course, but also how they can access housing and food, education, transportation, we can make a bigger difference in people's lives than if we just act as if we can take care of the health needs independent of everything else. When you think about Denver Health, you think about what we do for the community, what we do for our patients, but the truth is we have a lot of people who work for Denver Health who have some of the same circumstances, face some of the same challenges that the people we serve.
The Workforce Development Center is a center that prioritizes the advancement of Denver Health employees. Currently, we're prioritizing pathways and programs for our team members who are at entry point positions in the organization. We also connect team members to education and upskilling programs. Our patient safety attendant to certified nursing assistant program is a unique program. It's set up in such a way where we remove barriers. We provide tuition and scrubs and any other things that the team members will need to participate in the program. We pay them to work as a patient safety attendant while they're going back to school to get their certified nursing assistant certificate. I think the Workforce Development Center provides opportunity for growth, both personally and professionally for our team members. A great example of that is Miranda Hill. She came in as an enrollment specialist and has always wanted a clinical career.
I've always wanted to do nursing, and this just seemed like this was a great opportunity. This time in my life was a great opportunity to get started in nursing. So I graduated from the CNA Pathway program in May of this year, and I am now working full-time for Denver Health as a CNA. I love it. I think that it's very challenging, and I know I'm helping people, so that is what really gives me my strength and the momentum to get through my shift when it's tough like that. I just really appreciate being able to have the opportunity to work for Denver Health and just give back to them what they have invested in me. So I'm excited about my future.
I think another key component to the Workforce Development Center is our wraparound services. When we think about our team members' ability to progress inside of our organization, a lot of the barriers end up being kind of personal and life barriers. Danielle came into our center full of curiosity. She had seen our marketing poster and her picture was on it to promote the Workforce Development Services, and she was just thrilled that she was famous on the poster. But inside of those conversations, we started talking about her own development and career goals and desires, and she came and used our services, and she was supported by one of our career coaches, and now she's transitioned into a new role in the organization.
I started here at Denver Health October of last year, and I worked in the food service, and I had vowed to myself that I'm going to make a difference with the people downstairs in the food service. And so I did. I helped out with training, motivation, encouragement. I was there 6 months, and I interviewed for a position in the ER. as a hospital clerk, and I got the position. Thereafter, I did apply to join the workforce development here at Denver Health to see what that was all about. I'm here to make a difference, and I want to make that difference and show it through Denver Health. The clerical, customer service, awesome. The nurses, the doctors, awesome. And so that was a new career for me, a new stepping ground for me. What I love about Denver Health, what I love working here at Denver Health is the fact that it's just not a hospital, it's a teaching hospital, it's a community hospital, and it works with a vast amount of patients in different areas, in different categories. I like that because you meet so many people. You know, you don't just meet your own type of employees, you meet those who are just coming off the street. You meet those not just coming off the street and homeless, but they need some compassion as well. They need to know, yes, who I am, but do you take me for who I am? Do you value me as a patient for who I am? Yes, I don't have a permanent residence. No, I don't have a vehicle. And if I do have a vehicle, I sleep in my vehicle. Well, guess what? I have a vehicle and I don't always take my vehicle because I have to know and remember where I have come from to where I am now. To let them know you didn't just hire me as a Denver Health employee, you hired someone who wants to be an exceptional Denver Health employee and show off my Denver Health badge. And I show off my Denver Health badge.
We have incredibly committed people who work at Denver Health. The opportunity to offer patients a sense of dignity when they come through our doors is one of the things I am absolutely the most proud of. That only happens because of the people who work here. And our responsibility as an organization is to give our own employees the chance to take care of themselves and their families. It really is a privilege to be able to reach out and do for our own employees some of the things that we are doing for our patients. It's all about helping people to live their best possible life, however they want to define it, and standing behind them because that's who stands up for our patients.
We might be a large organization, but we provide $315 million of uncompensated care, for which the city gives us $30 million. We need support to be able to provide this sort of workforce development work, to be able to provide the time and effort it takes to do the equitable procurement and the thought leadership it takes to do the health equity work through CEDO.
It has been so impactful, positively impactful for me. And it has changed my life in wonderful ways, so I really am super grateful and just wanted to give a huge thank you to all the donors.
The organization is an awesome organization. It doesn't just help me, it helps all those within the community, that they're able to help others and better yourself. You have a goal, let's write it down, let's achieve it, let's move forward together and get it done. And that's what I like about Denver Health.